Hope is one of the spiritual principles that is the foundation of moving forward for most people. Without any hope, somebody will not get well. Whether it's a caretaker or someone with an illness, they will not get well if they cannot develop the spiritual principle of hope.
Hope is the foundation for living, especially with this disease. And I caution parents, though, to live one day at a time. So often I see parents move to the unrealistic hope stage. When is she going to go back to college? Is it a week? Is it a day? When's this chapter going to end? And I think that sets everyone up for some very unrealistic expectations. Hope has to be done in small dosages, too.
People think of the word hope as something we idly sit back and we do. We hope that things will get better. We hope that change will come. We hope that more caregivers will come into our community. But just sitting back and hoping in that form of the word is not where change happens. Hope is vital to creating change.
It's so important to let people know they can recover. That's the biggest message that I would want people to know. I would want them to hear that there is hope, that there are resources available for them and their loved one to get them through to a place of recovery. Regardless of where they are right now in their addiction, there is hope for a better life and a way out.
That is a huge part of recovery, starting there with the groundwork of you can get well, you can get better. And I think a lot of programs, and I think a lot of self-help meetings, and I think support meetings and developing supports with other people who are struggling with the same thing, that's what the whole point of that is to give people that hope that these people have gotten well, people have dug themselves out of similar situations.
It comes from a spiritual foundation, too, that things happen for a reason, and something good will come from whatever it is. Understand that a son or daughter has an addiction problem is so overwhelming, because when you witness that birth and you held them, you can't imagine, absolutely can't come to terms with how overwhelming it is to find out that son or daughter's shooting heroin. But yet there's that foundation of hope that brings persons out of despair.
When we're driving down the road, we need to be looking out our windows and looking for the things that bring beauty. We need to look to the things that bring peace and collaboration. That is vital to recovery. It's also vital to prevention.
I don't think we've experienced a lot of the positive outcomes because I think we publish the negative ones. There are really a lot of people who've turned their lives around and are successful. And we need to promote those people more than promoting what we see on TV about how many people they Narcaned. Yes, we have that, but we also have to see the other side. And I don't think there's an equal balance of what we're showing.
We all do this job because we want to make a difference and we want to help people. Whether it's we want to help people as a social worker, or we want to help people as a doctor or a paramedic or a police officer, we want to help people and we want to make them safe. Seeing the number of people that need help, trying to help them and having it not work, and having to do the same thing multiple times without any seeming hope in sight is difficult on people individually.
First responders in particular only see the beginning. They don't get to see the end. And so the beauty, in particular with the disease of addiction, is that there are millions of people recovering. There are millions of people who are doctors and lawyers and counselors and teachers and mothers and daughters, and they're living just incredible lives. And it may have begun, right, with an overdose or a Narcan or a visit to an ER.
Being able to get that other side of that story and realize that as first responders, they're really the trigger point of that story. And so where that's concerned, really kind of keeping that in mind and keeping that fresh is really important, because someone can run call after call after call, and the more distance we get from that hope, the more difficult it is to remember it. So I always suggest that.
When people ask me what I do for a living, I tell them that I get paid to witness miracles. And oftentimes the response is, well, that's really nice that you think that way. And at that point I say, no, it's not just nice. It's a reality. To see the change that can only be described as a miracle from a person that comes into treatment that is resistant, hopeless, and then to hear the stories years later of how recovery has absolutely changed not only the lives of their families, but of the community. And now to see them an integral part can only be described as an absolute miracle. Best job in the world, as I describe it.
When we think about first responders, it's so incredibly important to remember to maybe help them connect to the miracle that happens, to help them see the hope, to share with them some of these amazing stories. Because if there wasn't hope, I wouldn't come to work.
It sort of is like an immunization. You know, a lot of folks like to say, oh, you just opened Pandora's box, right? What folks don't remember about the myth is what was left in the bottom was hope. And so a lot of that hope is a really good inoculator, but a lot of times first responders don't get to see that. They're seeing folks literally at their worst moment.
When you're working with somebody in recovery, they're much more likely to engage in recovery if they feel heard, if they feel that you understand this journey that they're on and you're willing to go on that journey with them. I think combating stigma is very similar to that, in that we need to meet people where they're at and understand what they're going through and how they came to this belief system, and respect that enough to work with them to hopefully foster change and inject hope.
We have absolute miracles happen every day. So it's really critical to remember that they're only seeing the very first step. They're not seeing them dance 20 years later, 10 years later.
Well, one of the things we do is bring the people who have been successful back into that environment. So we had a couple patients who agreed to come back and talk to the judges about what their medication therapy had done for them. It was a profound effect on the judges because these people had been in front of the judges many times, and they explained what it was like to be in that condition without medication, without help, not knowing what to do. So they kept repeating their behavior.
Going to an Alcoholics Anonymous or Narcotics Anonymous open meeting and hearing people talk about, hey, look, I've been sober for this long, this is what this did for me. These are the outcomes that happen positively, instead of, okay, I've just had to show up on this scene and Narcan this 19-year-old fellow.
The opioid epidemic, as it were, has really taken a toll on our community as a whole on several different levels. Certainly in the area of child welfare and law enforcement, but also in the area of mental health and substance use disorder providers.
In doing so, a lot of the judges stood back and said, well, maybe we should rethink the way we're looking at this. And especially for the EMTs and the ED staff, they need to see that. They need to see that this person that came through here time and time again, here's how they're doing now. We have people who are frequent utilizers of the ED, and this is what our ED staff has seen, that since we started intervening with them, they don't come back, because now they realize, oh, this disease can be managed with me and my doctor, and I can manage this disease in that way instead of coming back to the ED. So that takes a lot off the ED staff, and when they see that happening, they actually think, wow, this is hopeful what you're doing.
In order to infuse hope into our culture, we need to be out spreading hope. We need to be out actively looking for the things that bring hope into our community. We need to find that hope.
It's such a worthwhile experience. I can't imagine doing anything else in my life.
Hope is the first step in getting well.